Okay, let's dive right in. What if I told you that for almost every single major heart event, we're talking heart attacks, strokes, you name it, there's a clear warning sign we could actually act on? Well, a huge new finding suggests exactly that, and it all comes down to one incredible number. 99%. Just let that sink in for a second. That's a number you really can't ignore, right? So what could possibly have such an overwhelming link to our heart health? The answer is pretty startling, but honestly, it's also incredibly empowering. Yep, you heard that right. A groundbreaking new study found that 99% of major cardiovascular events are preceded by at least one of four specific, and this is the key word, preventable risk factors. That means for nearly every person who suffers a life-altering heart event, there was a red flag that could have been addressed. Now look, this isn't just some number pulled out of thin air. This comes from a massive study that looked at data from over 9 million adults for up to 20 years. Researchers wanted to know one thing. What role do these changeable risk factors play right before someone has their very first major heart problem? To really get why this 99% figure is such a game changer, we have to zoom out and look at the bigger picture. We're not talking about some rare condition here. This is a full-blown global crisis. Cardiovascular diseases are, flat out, the #1 cause of death on the planet. Heart attacks and strokes, they make up a staggering 85% of those deaths. And on top of that, over 64 million people are living with heart failure right now. So yeah, this is the single biggest health challenge we face, which is why this new insight is so incredibly important. So you're probably wondering, what are these four preventable culprits the study zeroed in on? Well, these are the factors that, when they're not at ideal levels, pretty much set the stage for almost all major heart events. Here they are, the big four: high blood pressure, high blood sugar, high cholesterol, and tobacco use. The researchers were laser focused on these because, as the senior author of the study said, they are modifiable. In other words, these are things we can actually do something about. All right, first step, high blood pressure. For this study, that was defined as a reading of 120/80 or higher, or if you were already on medication for it. It's a super common issue, and this research just hammers home how critical it is to keep it in check. Next on the list, we've got high blood sugar. The line in the sand for the study was a fasting glucose level of 100 or more, having a diabetes diagnosis, or being on medication to control it. And culprit number 3 is high cholesterol. The study flagged anyone with a total cholesterol level of 200 or higher, or anyone on treatment for it, as having a significant risk. And finally, tobacco use. Now listen to this definition. It was really broad. It included anyone who was a past or current tobacco user. It's a powerful reminder that having even just one of these four factors out of whack can put you in that 99% group. Okay, so all four of these are obviously super important. But the study found something fascinating. One of them showed up far, far more often than all the others combined. I mean, just look at these numbers. It's striking. High blood pressure was present in over 93% of the US participants before they had a major heart event. By a huge margin, it was the most common warning sign. So why is high blood pressure the biggest offender of the bunch? Well, it's often called the silent killer, and for a very good reason. It's simple to detect, but it usually has no symptoms. You don't feel any different, and that's exactly why it so often gets missed until it's too late, making regular checks absolutely essential. So this brings us to the most important part of this entire conversation. What do we do with all this information? The message from the researchers couldn't be clearer. Prevention is the best prescription. Dr. Philip Greenland, the study's senior author, puts it about as directly as you can. He says that patients need to make sure these four factors are checked at every single doctor's visit. And if there's even a slight elevation, action needs to be taken to treat it and prevent something serious down the line. And this isn't just one person's opinion. The sentiment is echoed by other experts, too. Dr. Cheng-Han Chen, who wasn't involved in the research, said this study just reaffirms the need to aggressively screen for and manage these risks. The consensus is crystal clear. We have to be proactive. At the end of the day, this is a message of empowerment, not fear. The connection between these four factors and serious heart disease isn't just a possibility. This data shows it's practically a certainty. So the real question becomes, knowing these factors are preventable, what's the one conversation you can start with your doctor at your very next visit?